Welcome to the introductory PowerPoint to NCCAP certification. It would be helpful if you had a copy of the NCCAP Certification Standards booklet, which can be downloaded and printed from the NCCAP site, or at least have access to the booklet on the NCCAP site as we go through this presentation, as several of the pages will be referenced. About NCCAP. We are the only national nonprofit independent standards and certification body recognized by the Centers for Medicare and Medicaid Services, CMS, for quality of life, activities, and engagement certification across all care settings. NCCAP was established by the National Association of Activity Professionals to offer the highest level credential of qualification as a certified activity professional. Established in 1986 in response to the Omnibus Budget and Reconciliation Act, NCCAP has been using the social model of care to set the standard for person-centered care that improves the quality of life for older adults. Since its inception, NCCAP has trained and certified over 150,000 individuals. Meet Peter Illig, our Chief Executive Officer. Mr. Illig previously served as General Counsel and Director of External Relations for World Scouting, where he ensured legal compliance and established strategic partnerships with global organizations such as the United Nations and Red Cross. A registered consultant with the World Health Organization, he worked in Washington, D.C. for the law firm Holland & Knight and was an advisor to the World Bank, the Asian Development Bank, and United Nations on health and environmental projects. He served on the Environmental Health Roundtable of the National Academies of Science and the Institute of Medicine. Mr. Illig holds a Master of Laws in Public International Law from the University of Notre Dame, London Law Program, a Juris Doctor from the State University of New York at Buffalo, and is admitted to practice law in New York State. He serves on the Transatlantic Council Executive Board of the Boy Scouts of America and is an international advisor to the U.S. medical charity Operation Smile. Why NCCAP? It might be helpful if you would refer to page 2 of the Certification Standards booklet, as some of these points will be referenced there. The education and certification programs of NCCAP provide the foundation for person-centered care. From aging in place at home and along the journey of long-term care and hospice, continuity of care is critical. It includes non-medical skill sets such as assessment, communication, engagement, planning and delivery of activities. The right techniques can help get someone to bathe, go to therapy, or just play a game. Knowing the right techniques for behavioral interventions is essential, can reduce risk of injury, and can improve quality of life. NCCAP credentialed caregivers learn the best techniques tailored to the individual's cognitive and physical limitations for those in their care. As approaches to long-term care evolve, NCCAP is at the forefront, creating best practices and the standard of care for the following. 1. Families wishing to age in place or waiting for a place in a long-term care facility. 2. Veterans in the VA system or at home and dealing with behavioral health issues such as PTSD. 3. Long-term care companies searching for cost reductions through better trained employees. 4. Adult day centers expanding services and seeking to hire employees with skill sets that include dementia care. 5. Governments, insurance companies, and hospitals trying to reduce the growing costs to care for our aging population. To address this nationwide need, NCCAP provides education, training, and certification for improved quality of life in any setting. NCCAP certifications are based on rigorous criteria that ensure they meet the requirements of federal and state regulations. Having certified activity professionals who have helped millions of seniors, NCCAP is uniquely experienced to do the following. 1. Set standards that contribute to an improved quality of life. 2. Provide a trusted credential that ensures an individual has met best-in-class requirements for certification. 3. Educate government, industry, agencies, and families on factors that impact the quality of life of a caregiver and the person in their care. 4. Affirm that NCCAP certified individuals has received an education that meets the highest standards and that the credential satisfies the regulatory requirement for the position. 5. Advocate for federal, state, and local policies that advance person-centered care and improves the quality of life for older adults. Based on the proven social model of care, NCCAP strives to improve the quality of life in all care settings. We continuously update our standards based upon the latest research, regulatory guidance, and survey information that ensures to the highest degree possible compliance with applicable requirements. The benefits of NCCAP certification are many. The educational components of all NCCAP certifications are modular building blocks. Each module is based on the foundation of person-centered care through activities and engagement. Each NCCAP certification is based on over 30 years of training and education from across multiple long-term care settings. Our standards ensure continuity of care and approach. This improves quality of life for all involved and reduces the cost of care incurred by families, agencies, and governments. There are many benefits to our home care certification. For the families, by providing peace of mind that their caregiver has met rigorous educational standards to become NCCAP certified. A home care certified caregiver can offer family members insight on communicating and engaging with loved ones living with dementia. There are benefits to the home care employer, staff retention, reduced recruitment and administrative costs, as well as higher client retention. There are benefits of the home care certification for state and federal agencies, which include reduced cost of care and reduced readmittance to hospitals. There are benefits of certification for long-term care communities and day centers. From meeting federal or state requirements to staff continuing education needs, the standard certifications and educational content provided by NCCAP offer multiple benefits to long-term care facilities, which include the following. 1. NCCAP certification is recognized by the Centers for Medicare and Medicaid Services as an organization that certifies activity professionals who work specifically with the older adult. 2. NCCAP certification assures administrators and surveyors that you have met professional standards required for certification and can assist the community in meeting specified requirements while also improving quality of life for residents and other staff members. 3. NCCAP certified professionals can offer fellow staff insights and best practice on how to communicate, engage, and intervene with those living with dementia. 4. NCCAP certification offers individuals the opportunity for increased wages and can be a gateway to professional advancement within your organization. There are many benefits of NCCAP certification for government and nonprofit agencies. Federal, state, and local governments, along with nonprofit agencies, can realize the benefits and added value provided by NCCAP certification through higher employee retention rates, lower staff turnover, reduced recruitment and administrative costs, reduced costs for the delivery of care, and lower admission rates for hospitalization, skilled nursing facilities, and readmittances. There are many benefits of NCCAP certification for the activity professional themselves. Activities are the foundation of care. Activity professionals are the pillars of the foundation, and our organization, recognized since 1986 by the Centers for Medicare and Medicaid Services, NCCAP has trained and certified over 150,000 individuals. NCCAP's person-centered activity and engagement programs, based on the social model of care, set the gold standard for long-term care and quality of life. Here are just a few of the benefits to becoming NCCAP certified. 1. Federal law states that the activity department must be directed by a qualified professional. Since 1986, NCCAP has been accepted as meeting this requirement. 2. NCCAP certification assures administrators and surveyors that you have met proven criteria and professional standards to become certified. 3. Many administrators will only hire activity professionals who are certified. And 4. Some administrators offer a higher salary to certified activity professional. We've expanded our certifications to meet the needs of other professionals who are engaging in activities under the social model of care. Peter Illig's goal was to streamline the certification process to make it user-friendly not only to the professionals seeking national certification, but also to the business owner, regulators, and government officials. At this point, you might want to look at page 3 of your Certification Standards booklet, as this information will be reviewed there. So let's talk about our certifications. Activity Professional Certification, also known as NCCAP Regulatory Compliance Certification. You'll see that there's Activity Assistant, Activity Director, and Activity Consultant. Each level of certification has different tracks or different ways to meet the requirements for certification. We have streamlined and condensed a couple of the tracks for Activity Director certification, and we are very proud to introduce a new professional pathway for those individuals who are currently certified as a CTRS or music therapist or art therapist. Setting-specific certifications. We now have certification for individuals working in home care and also adult day services. Engagement certification, which is open to all allied health professionals, not just activity staff. This is a new level of certification, has been developed to assist a facility in meeting the new regulations. Throughout the over 52 federal regulations that reference activity and engagement services, the recurring theme is facility involvement. If we just take a minute to discuss FTAG 679, it states, the facility must provide, based on the comprehensive assessment and care plan and the preferences of each resident, an ongoing program to support residents in their choice of activities, both facility-sponsored, group and individual activities, and independent activities, designed to meet the interests of and support the physical, mental, psychosocial well-being of each resident, encouraging both independent and interaction in the community. CMS recognizes that research findings and the observation of positive resident outcomes confirm that activities are an integral component of residents' lives. Residents have indicated that daily life and involvement should be meaningful. It is becoming a recurrent issue that facilities are receiving FTAGs or deficiencies under activities for lack of meaningful engagement. The times that are being cited are outside the traditional structured group time. It is evidence that the focus is truly moving to a facility responsibility. Therefore, our newest certification for engagement is Montessori certification, is open to other healthcare workers beyond the activity professional. Now a nurse, nursing assistant, a universal worker can become educated and certified in the therapeutic techniques of Montessori. NCCAP is excited to announce a formal partnership with Brush Development Company to create NCCAP certification to meet the needs of persons living with dementia. With over 25 years of experience, founder Jennifer Brush is a speech-language pathologist and internationally recognized Montessori dementia expert. She is the only certified Montessori for aging and dementia educator in the United States, teaching the Montessori Dementia Care Workshop. For more information about the Montessori Dementia Engagement Certification and our training program, visit the NCCAP website under Engagement Certifications. Let's talk about some of the qualifying components to apply for national certification. You might want to look on page 4 of your Certification Standards booklet, as this information is outlined there. The first thing that's needed is academic education, which will be considered your high school diploma, your GED, and any college courses that you might have taken. 2 is activity experience. Any activity experience that you're using for national certification has to be within the last 5 years or within 5 years of applying. And we define activity experience as working with older adults. 3 is continuing education, which will be seminars, workshops, and in-services. Again, these have to be taken within 5 years of applying and have to be within the body of knowledge, which will be explained later. 4 is required curriculum. For some of the certifications, there's required coursework, and that will be explained in the next slide. 5 is the national exam, which is required if you're doing the Activity Director Certified or Activity Consultant Certification, and 6 is consulting experience if you're going with Activity Consultant Certified. There are some required courses that go with some of the different levels of certification, which are also explained on page 4 of your Certification Standards booklet. The first course that goes with regulatory compliance certifications or the activity professional certifications is the Modular Education Program for Activity Professionals. This course is a 2-part program involving a total of 180 hours of educational learning and 180 hours of experiential learning that includes practicum work. Each part consists of 90 hours of coursework and 90 hours of practicum assignments. MEPAP Part 1, Core Content 1 through 11, prepares students for the essential functions and duties of an activity professional to design, deliver, and evaluate activity services for older adults across the continuum of care. MEPAP Part 2, which covers core content areas 12 through 20, prepares students to apply principles of management in their role as an activity professional to provide services through leadership, advocacy, and using principles of planning, organizing, staffing, directing, and controlling. For the specific setting certification, we have the home care certification class, which is called Activities 101. This course establishes a baseline knowledge for home care partners involving the skills needed to improve the daily quality of life of a client by engaging a client in discussions and activities, potentially decreasing incidents of accidents and dangerous situations, preventing boredom, depression, and disengagement, and avoiding relocation from home to a long-term care facility. The setting-specific training for adult day services is MEPAP Part 1. We also have training to go with our engagement certifications. The Can't to Can Do Using the Montessori Approach course provides an introduction to using Montessori with older adults and people living with dementia. The curriculum focuses on engaging individuals in person-centered activities that have meaning and purpose for an improved quality of life. Let's look at some of the different certifications and what's required for each. We're going to start with Activity Assistant Certified, which you can find on page 5 of the Certification Standards booklet. What you're going to find as we look at all of the grids for these different certifications are some common features. On the very left column, you'll see the heading called Qualifying Components. For each certification, the same qualifying components are defined. Then you're going to see different tracks, and all a track is a different way to qualify for that particular certification. It's a different path. So let's look at the qualifying components. On the left, you'll notice that's academic education, which is your high school diploma or your college credits, activity experience, which is working with older adults in an activity program, continuing education, which is seminars and workshops and in-services, and then the required curriculum, which is whatever course is required for that particular certification. Then as we look at the two tracks, you're going to see that there are some similarities. For example, if you look at the continuing education and the required curriculum, they're the same for both tracks. But if you go to the very top under academic education, you'll notice that the first track, which is a high school diploma and 6 college credits, needs less work experience than an individual who just has a high school diploma. And that's the common feature you're going to see through a lot of the different certification tracks, is the more education you have, the less experience you will need. But there are some consistent features, such as the continuing education remains the same or the required curriculum remains the same. If you look at the bottom of page 5, you'll see that there is an Activity Assistant Certified Provisional, AACP. This is a track for individuals who are in high school or don't have a lot of work experience and are working towards becoming certified. And you can see the requirements are listed below that. Basically, someone who has a high school diploma or is currently enrolled in high school and has only volunteer hours, 50 hours of volunteer hours are required, and then 20 hours of continuing ed, and then completion of the MEPAP class. This certification is valid for 4 years, as you can see, and it's renewed every 2 years. And after the 4-year period, the individual has to have accrued some activity, actually paid activity experience, to do a level change to Activity Assistant Certified. Let's talk about Activity Director Certified. At this point, you want to go to page 6 of your Certification Standards booklet, and you'll see this grid there. Again, on the left-hand side, as we've looked at before, you'll see the qualifying components, but there's one thing added to Activity Director Certified. At the very bottom, you'll notice it says National Exam. The Activity Director Certified requires the national exam for all tracks. So to become Activity Director Certified, you would have to take and pass the national exam. Now you can look at the 3 tracks, track 1, 2, and 3, and the main difference between all 3 of these tracks is how much college you have. You'll notice under track 1, you have a bachelor's degree. Under track 3, you have 12 college credits. All college requirement requires a completion of some sort of English comp or English writing class. The difference with the amount of college you have is reflected in the second line, which is activity experience. If you have a bachelor's degree, all that's required is 2,000 hours or 1 year of work experience within the last 5 years. If you have less college, you'll notice the experience requirement goes up. So if you only have 12 college credits, you would need 3 years of work experience. You'll notice the continuing education requirements and the required curriculum remains the same for all of the tracks. Now you might want to look on page 7 of your Certification Standards booklet and look at Activity Director Certified Provisional. This is a transitional certification, which is for those individuals who are working towards ADC certification but don't have all the requirements. In order to apply for this, you can read the requirements at the bottom that you need a high school diploma and you need to have completed MEPAP Part 1. And then if you continue to read, if you can meet some of the requirements as it's defined, I'm not going to go through them all, but if you meet the requirements either through activity experience, continuing education, or have completed the MEPAP Part 2, you can qualify for Activity Certified Provisional, and that certification is good for 6 years. You would have to renew it every 2 years, but at the end of the 6 years, you would have to do a level change to Activity Director Certified by meeting the remaining components of ADC. We also have 2 more Activity Director Certified tracks, and you'll see them on page 7 as well. Track 4 is for those individuals who have more activity experience than most. You'll notice the activity experience is 12,000 hours, or that's actually 6 years. You've taken the MEPAP Part 1 and Part 2, but you don't have college. In order to achieve this, you would have to come up with 40 hours of continuing ed within the last 5 years, and at least 8 of those hours has to be on the subject of activity documentation. We also introduced a new track this past year or so, Track 5, which is a professional equivalency path. If you are a CTRS, or you're a certified music therapist, or an art therapist, or an OT, you qualify to apply if you have 5 years of work experience. You would have to submit 40 hours of continuing ed, 8 of which is on activity documentation, and then that would make you eligible to sit for the national exam. We can look at Activity Consultant Certified, which would be a goal for you in the future. Activity Consultant Certified has the same requirements. You'll notice on the left the qualifying components, and at this point we're on page 8 of your Certification Standards booklet. There is an added component beyond the national exam, which is actual consulting experience. College is required for all levels of Activity Consultant Certified. You can either have a master's degree or a bachelor's degree or an associate's degree, which is on page 9 of your Certification Standards booklet. And you can see that you have to have recent activity experience, 40 hours of continuing education. You have to have completed the MEPAP Part 1 and Part 2, and then the consulting experience. To apply for ACC, you would need 200 hours of activity consulting experience within 3 years. Or there's an independent study activity consultant course which you can complete, and then that would complete the requirement for consulting experience for these 2 levels of certification. We also have an Activity Consultant Certified track for those individuals who have an associate's degree. In this case, you would need 6,000 hours of activity experience, the 40 hours of continuing ed, like the other ACC certifications, the MEPAP Part 1 and Part 2, but to qualify for the consulting experience aspect with an associate's degree, you would need 200 hours of actual activity consulting experience, which is defined in the Certification Standards booklet, and completion of the independent study course, which is the activity consultant course. So there is potential to become activity consultant certified with an associate's degree, but there are some additional requirements. And this is noted on page 9 of your Certification Standards booklet. Let's look at some of the setting-specific certifications, which are on page 11 of your Certification Standards booklet. As you can see, we have a specialty certification for home care certified. In order to achieve this, you would need 1,000 hours of home care experience, 20 hours of continuing ed, and completion of the Activities 101 course. This certification is renewed annually. We also have an Adult Day Services certified specialty certification. This one you need 4,000 hours of adult day services, you need completion of MEPAP Part 1, and also 20 hours of continuing education. This is renewed biannually, and this is on page 11 of your Certification Standards booklet. NCCAP is happy to introduce engagement certifications. At this time, we have the Montessori Dementia Engagement Certification, which is open to all healthcare professionals who work in the field of aging, such as activity professionals, nurses, nursing assistants, home care aides, rehab aides, and social workers. You do not have to be NCCAP certified to achieve this. In order to attain this, and you might want to go to page 12 of your Certification Standards booklet, you would need a high school diploma, 2 years experience in working with people living with dementia within the past 5 years, And that could be in any capacity, as a CNA, as a social worker, but evidence of working with folks who are living with dementia. You would need 20 hours of continuing education, and then you have completed the From Can't to Can Do using the Montessori approach training program, which can be accessed from the NCCAP website. Once that's completed, you apply, and that is renewed annually, and you would have MDEC after your name, Montessori Dementia Engagement Certification. We've covered a lot of information in this PowerPoint, and if you have additional questions, I would encourage you to look through the rest of your Certification Standards booklet. If you look starting on page 13, you'll see that there are several pages defining the various terms and things that we've spoken about. There's information about what qualifies as activity experience, what proof do I have to have for documenting my activity experience, and the same thing goes with my education, my continuing education, and other items that might be needed for the certification application. If you go to page 19, there's several pages of the body of knowledge. I've referred to the body of knowledge a few times in this PowerPoint, and basically what that is just a list of acceptable topics. The body of knowledge is rather broad. It's pretty much anything on the subject of aging, dementia, older adults, long-term care, quality of life, activities, recreation, and the various interventions that we're involved in. So if you attend a training and can get a certificate and it has the appropriate information in it, which is defined in the definition of terms, we pretty much can use that for continuing education. You would want to review the requirements for online continuing education because there are some very specific requirements associated with that before you complete those trainings. I hope you have found this PowerPoint informative. If you need additional information, visit the NCCAP website at ncap.org. If you're one of my MEPAP students, one of your assignments is to create a student profile on the website and also begin your planned certification. If you need assistance with either of those tasks, please reach out to me. You have my contact information, and I'll be happy to assist you in defining your path to certification.